Okay, I've got the ready sign, so we're going to get started. Good morning, everyone, and welcome to day 3 of the 2023 BC Digital Health Forum, brought to you by a fantastic organizing committee, including teams across PHSA as well as the wider healthcare system. You can certainly see their logos. It's down low, but they're there, I guarantee you. After a fantastic start to the forum with 2 days of virtual presentations, we're really excited to be offering a hybrid agenda today with many digital health enthusiasts in the room and as well many online. My name is Tina Costa, and I'm one of the directors with the Office of Virtual Health with PHSA, and I'm honored to continue to be your host. Those of you who've joined the last couple of days may be sick of hearing my voice, but here we are. Today, we have an exceptional lineup of panel discussions where the conversations will really explore how digital health is not only improving patient outcomes and bringing healthcare closer to people, but how digital health is truly shaping the future of health and of care. One of the highlights of today's program is our patient panel. This panel is a reminder that behind every data point, every piece of technology, and every medical breakthrough, there's a human. And that human certainly deserves the best care possible. We've got a lot of them sitting in the front here. We really hope that you enjoy these carefully curated conversations that are bound to bring some new insights and some inspiration. But remember, the event is not just about the information that you receive, it's about getting together, getting to know one another, collaborating, asking questions, and learning. A couple of housekeeping things before we dive into anything really important, but just a moment to managing hybrid and the in-person event. So just a bit of patience as we go through some of this stuff. Huge thanks to our ASL interpreters that are here live today and the captioners online who continue to support an inclusive environment for our audience. Wi-Fi is available. It was up earlier. If you didn't catch it, it'll be on screen again shortly. Our panel moderators will be facilitating questions between yourselves as well as the virtual audience. And so for those of you that are online, you'll continue to put your questions in the Q&A using the icon at the bottom of your screen. Those of you here in person, inside those lovely yellow bags that you can't miss, there's just some little question cards, or we'll just have some runners if you put your hand up and we'll use a mic. In terms of evaluation, also in your little goodie bag, there's some cards, just some blank evaluation cards that we'd love for you guys to fill out as you go through the day. Before you leave, either leave them on your chair, or we do have a box to collect them at the end of the day or throughout. Online, it will continue to be the same, where the Zoom poll will come up on your screen at the end of each session. You'll fill that out, and then you can transfer over to the next session. We do have gamification still happening. Lots of prizes to be won, so check out, if you haven't already, the FeedLoop Go app. There is also a number of QR codes hidden amongst this space for those of you in person, so keep an eye out for those. In terms of social media, we'd love for you guys to share pictures or thoughts about what you're learning. We do have a selfie background for those of you who are really interested in it coming up during the breaks. Would really appreciate you taking your photos and sharing them. Couple of hashtags. First one is hashtag BCDHF, if I can say that. Otherwise, hashtag BC Digital Health. And finally, if you have any questions or need assistance throughout the day, please look out for our event team. We'll be the ones sort of running at or walking at a faster pace probably than the rest of you, but we do have some stars on our name tags. Okay. With that, and before we have some opening remarks, want to invite everyone gathered here today in person and through our virtual circle to take a moment to acknowledge with gratitude that we're joining together from many traditional, ancestral, and unceded territories of BC First Nations. For those of us gathered here at BCIT, we would like to acknowledge that the BCIT campus is located on the unceded Indigenous land belonging to the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh First Nations. Let us give thanks again to the opportunity to gather, learn, and collaborate together. I recently had the opportunity to accept a gift from our Indigenous health team at PHSA as a token of my commitment in my own learning and what I refer to as my reconciliation. And so these small paddles that I'm wearing today are inscribed with a number of the Coast Salish teachings that were gifted to PHSA by our knowledge keeper, Sulkson, also known as Elder Shane Point. And so today I invite you to share in one of my reflections, and you'll see it on the screen here. The saying is I slackson, which means good medicine. Elder Shane Point explains to us that medicine is all things, that it is the geography, the ecosystem, and all living beings. And as humans, we can make the choice to either be good medicine or bad medicine. And obviously, our intent, I hope you share in mind, for us to be good medicine today, to let us be good medicine to ourselves by honoring the new knowledge and new perspectives we hear today, to each other by sharing our learnings, connecting with one another, and creating strong, respectful partnerships. And finally, good medicine to all of our communities by acting together to enact solutions and innovations that have immense benefit to all Indigenous peoples, to all patients and families, and truly to all of us as receivers of care. With that, I'm going to have a couple people come up for some opening remarks. First, I'm going to invite Glynda Rees. Glynda is the program head for the BCIT Advanced Certificate in Digital Health, key partner on the organizing committee, and truly the reason why we're in the room physically. So over to you, Glynda.
Thank you, Tina. And it is my honor to welcome you here to BCIT and our Tech Collider space, which is a fairly new space, as you can probably tell, and is meant to be enjoyed as a collaborative opportunity. So I welcome you to spend time networking and meeting one another. A couple of little housekeeping pieces. There are ladies' washrooms back that way, men's washrooms back that way. We don't have gender neutral bathrooms in this facility, as far as I know, unfortunately. The fire exit is there right on the at the stairway. And this evening, we're hosting a networking reception up on the 8th floor. So after we finish up here today, we'll be moving up to the 8th floor to the atrium, which is another beautiful space to enjoy some appies and drinks. And that's pretty much it. Thank you for coming. It is going to be a wonderful day and really appreciate having you all here. Thank you. Thank you.
Thanks so much, Glynda. Next, I'm going to invite Mike Cleghorn to join us. Mike is the Chief of Provincial Digital Solutions with the PHSA Provincial Digital Health and Information Services portfolio. He's going to offer some opening remarks and introduce our keynote speakers.
Good morning. Lots of applause. That's all I have to do is say good morning. I get applause. You guys are easy. That's great. Good morning, everyone. Really honored to be here. And as Tina mentioned, this is a really exciting opportunity for us to collaborate. The collaboration in action, I think, is something that's really indicative of where we are now, right? As a healthcare sector and health system in BC and across the nation, and you could even reflect across the world, it's really about collaborating and breaking down some of the silos. Those silos have been evident for years for various, good reasons, but now we need to start to collaborate. We need to recognize from a place of humility that we can do better, right? We can collaborate better. We can share stories. We can share more. And I want to reflect on one thing that Tina said about, learning and networking and being here together. We have a really incredible opportunity to share, to take what we've had here today and what we experienced here today and over this whole week and be able to share it more, share with our peers, share with our families, share with our networks. Not everybody can be here today in person or online, but we're going to get some really rich content. So I would just want to challenge you and encourage you to take this back, spread the opportunities, spread the fact that we are here in a connected health system, and that in order to really achieve the values that we want to see as British Columbians and members of this sector, we have to be able to challenge ourselves to think differently and do a little bit more. I know we're going to hear from our keynotes this morning about the strategy and what, how unifying across the digital health sector, British Columbia is really unifying itself. And so now we're in a position to take action. We're in a position now to be able to say, hey, we have years and decades of experience. We've got evolutionary opportunities that have revealed themselves through various, disasters and opportunities. And on the heels of the pandemic, we're still in a state of opportunity. We saw the silos that were spoken to before. They were breaking down and broke down during the pandemic. Let's not rebuild those. Right? Let's leave those walls down and let's start to collaborate and continue to collaborate and show that in the way that we deliver our systems, our solutions, the way that we engage with our patients, we engage with our Indigenous peoples and the elders to learn from the teachings and apply them to a really future state mindset about the way that we can actually deliver healthcare in a digital environment that is so evident today. We have challenges with access and availability of services and equity and equality. And through digital means, we can provide excellent healthcare in a more accessible way, a more safe way, and a manner that's more comfortable to our patients and families. We know that so much of healthcare is delivered by the extended network of care providers. That's the families and the friends and the communities of people that are patients. I really think that we have an opportunity to connect the health system where people are empowered to do more with their healthcare, within their community, and with each other. And that is, again, one of the themes of the digital health strategy is to be able to say, we have to recognize the experience of this, the experience of the providers, make that easier for them to do their best care, experience of the patients and their families so that they can receive the care in a manner that's most comfortable for them. And we can connect the health system in doing this in a better way. And finally, we have to make sure that we enable everybody to do this in a streamlined way. Healthcare is a massive business, and it's an important business that we remain prudent with the way that we expend our resources. And I think we can continue to connect the health system and be collaborative, demonstrate that action together across organizations. And today is really indicative of that, of us being able to come together in a central space here together, share, collaborate, and learn from each other. So in closing, as part of the opening, I would just encourage you to take what you have here today and share it outside, expose to others what the healthcare system in BC is doing, what it can do, and where it's going. And I really enjoy the fact that we are here together and we can all be a part of it. So with that, I'll turn it back to Tina and welcome you all to the day. Thank you.
Thank you, Mike. You're much taller than I am. So it's now my honor to introduce our keynote speakers for today. We have Michael Tatto and Heidi Giesbrecht joining us. Michael is the Chief Digital Innovation Officer at PHSA, where he leads a team that supports digital solutions within the health sector in BC. Michael is a visionary leader who believes in a strategic approach and hands-on leadership style to enhance healthcare service delivery and operational efficiencies. He champions dynamic enterprise architecture and strategy teams to ensure transformative outcomes in the healthcare sector. Heidi is the Executive Director of Health IT Strategy at the BC Ministry of Health. She has dedicated her career to advancing technologies that transform healthcare. Heidi is a strategic leader that guides teams to bridge the gap between innovative technologies and enhanced patient outcomes by drawing from a dynamic career in the BC provincial government and private sector. Heidi has a Master of Engineering in Biomedical Engineering and a Bachelor of Engineering in Mechanical Engineering from McGill University. And prior to her work at the BC public sector, she led the design, development, adoption, and regulatory clearance of a diverse portfolio of medical devices and digital health solutions. Heidi's multifaceted experience makes her a well-rounded expert, uniquely positioned at the intersection of public service, technology innovation, and healthcare leadership. Please join me in welcoming Heidi and Michael to the stage.
Thank you, Tina. Oh, is that us?
I think she was talking about us.
Well, I am incredibly humbled to be holding space with all of you here today. And sharing this stage with my dear colleague, Michael Tatto. I'm here to open today with sharing of the digital health strategy, a deeper look at some of the successes so far, and where we're going from here. Next slide, please. So we'll look at some highlights of what we've learned, some of our current priorities and opportunities, and what our road ahead looks like. Next slide, please. We should be really proud of ourselves. We are making progress at this very ambitious agenda that is in front of us. We have had significant digital health advancements achieved across the three major pillars of our strategy around enabling improved patient and provider experiences. We've expanded the Health Connect registry to better connect primary care providers to the people who need them. We've launched new provincial online booking systems for people so that they can see a pharmacist online and access those services that are part of that expanded scope of practice. That's huge for our province, and that's opening up access for our patients and our people. We've accelerated the vaccine program, and we continue to deliver life-saving vaccines across the province in ways that we've never been able to achieve before. We're expanding citizens' access to health information and their history and services, all online through new digital technologies. We've optimized how our home health monitoring programs work, and we continue to strive toward and deliver on new solutions that connect young people with much needed mental health supports. We know how important it is to support our providers and to ensure that they have access to streamlined tools that ease the burden of the work in their day-to-day. We're building new online registries for those providers so that they can manage their patient lists and they can tell us when they have the capacity and they can start to support additional patients as part of their healthcare clinics and service offerings. We're creating new clinic and provider registries so that we have better information to be able to support those providers with the kind of services and supports that they need in order to do their job. We're working hard to deliver on virtual care solutions that will allow those providers to connect with patients, and we're enhancing the information sharing across clinics, health authorities, and the broader public sector so that we can work more collaboratively and more effectively together. We're doing all of this while also recognizing that we need to strengthen our provincial alliances across the sector so that we can achieve greater economies of scale and that we can leverage some of our major investments in clinical information systems. And we're doing that through coordinated provincial planning that's cross-cutting and involving our HR, our finance, as well as our IMIT leaders and our clinical leaders to ensure that we're arriving at sustainable and scalable solutions for the future. These are the celebrations. This is what we should be proud of. And this is what we've accomplished so far. But that's not all, and that's not where it ends. Next slide, please. I think our Premier, David Eby, said it best when he said, we must be forward-thinking, strategic, and ready to work across disciplines and old divisions in new ways. And that's exactly what we're doing today. We're looking at ways that we can enable through digital health and digital technologies and virtual care so that we can address some of the grand challenges of our province today. This touches on primary care, ambulance services, access to rural health. We're introducing new medical schools and new credentialing programs and adding capacity to our system, but we have more work to do in supporting health human resources, our long-term care homes, mental health supports. We still have backlogs that we need to address, and cancer care is emerging as a critical priority for us in this coming year and the years to come. We're doing all of this while ensuring that we're doing everything that we can to create an equitable healthcare system. And we're fighting, and we must continue to fight anti-racism in our healthcare systems every day and in the days to come. Next slide, please. There's a history to the digital health strategy. We started this work in about 2019. And if you remember, 2019 was before the pandemic. We realized through learnings of that initial strategy, the emerging new priorities, as well as what we encountered during the pandemic, that it was time for a refresh. And we undertook that refresh in 2022. We did that through extensive engagement and consultation to ensure that we helped shape a digital health strategy that was going to guide us toward an effective and efficient, digitally enabled healthcare system. The strategy commits us to significant transformation so that we can ensure that technologies that we're introducing today and tomorrow are going to support the well-being and lives of people of BC for this generation and generations to come. The pandemic led us to new ways of working and new digitally enabled ways of interacting with each other. And that completely changed the context of today. We have an increasing expectation to be able to access and interact in an online-first world. People have expectations to have consistent online, provincial-wide services in an equitable and accessible way. And this really drives us to collaborate in new ways across our partners, across health authorities, across research communities, nationally and globally. We're really excited because this strategy is right at a point we're ready to publish this really broadly to our public and our communities. And we're in the final stages of putting that forward through a communications. And so we'd like to offer that in the days to come, stand by, and you'll see that shared broadly. But for today, we're going to give you a little deeper dive. And so I'm going to pass it over to my very dear colleague, Michael Tatto, to talk through some of the key areas of the digital strategy. Oh, I realized I missed a slide.
That's okay. I love talking.
Do you? Okay, you're going to go for that one.
Sure.
Okay, go for it.
So, thank you, everybody. Can I have the next slide, please? I think it's, I'm going to move this just to make sure I always think it's important to set the context of where this strategy fits in kind of the, what I would call the, the layers of strategy that we would have. So for us, obviously the top of that pyramid is the BC government principles. Underneath that, we're going to have each of the health authorities get what we call a mandate letter. There's kind of direction that the government wants the health authorities and kind of the sector to move. So that's really going to be how we deliver clinical care, et cetera, across the province. And underneath that, you will find the provincial digital strategy. So that does allow us to set a kind of a baseline for digital strategies across the province. And underneath that, you will find the what we call specific sub-strategies. So that would be digital strategies for different health authorities, also different strategies that support the digital health strategy as a whole. So I'll just go to the next slide, and we can just start talking about the strategy itself. So this is the strategy on a page. It is kind of the best way we could summarize all of the Word document. And what I'll do is I usually start from the top and I'll work my way down through it. So our goal, so the goal is a digitally enabled health system trusted by all who use it. And I always like to reflect on how we got to that kind of somewhat simple statement. It was, the first iterations of this statement were like multiple paragraphs because we wanted to get every little detail, capture every comment that we had received or our large engagement that we had around this strategy. And so as we whittled it down, each of those words became very, very important. And I think the one that I always like to focus on when I do this talk is talking about trusted. And so for each of those strategic pillars, which I'll get to, trust means something different. For patients, it means, do I trust that I am attached to our system? Do I have the access to the information I need? For it's our Indigenous communities, do we even trust that we can share this information with the system? And then for providers, do we trust that, I know everything I need to know about my patients? And so as we go through all of these and all of the different solutions, that trust has to be part of that work. So our vision is that digital health services, tools, and processes support a connected, safe, and trusted health system that empowers all users and address population health needs. So those are the goal and the vision. Now we have 4 strategic objectives in this strategy. And I know Heidi just mentioned the strategy we had in 2019. I like to sometimes do a contrast between what we had in the past and what we have now. Is when we kind of did this, we kind of came up with 3. I always like to talk of the first 3: empower patients, improve provider experience, and the connected health system. And what we did there was we wanted to get it as simple as possible. We wanted to really emphasize the fact that these things kind of intertwine together. They're not separate silos. We really have to think of these as a flow across. Excuse me. And then the next one was enable the business enterprise. And that one we kind of added a bit later when we started to realize the importance of I would call it the big iron that runs the systems, that we need to look at it in a provincial manner. Like, how can we do this holistically across the sector? So within any strategy, you have critical enablers that allow you to deliver on what the strategy is. So I like to go to maybe the most obvious one: sustainable funding. For us to deliver this, we need to make sure we have the money and the funding to do it. But there's also a really important things that we have privacy laws in our province that are a little different. We have areas that control our community providers versus what we have in the acute care settings. And so those are challenges for us. So that, one of those critical enablers for us is the policy and the regulatory changes that we'll need to make. So that is the strategy on a page. As Heidi says, these things hopefully will share out and people will be able to see it in the more details, and there's a much more robust documentation around it. What I'm going to do now is I'll go to the next slide. And this is kind of the breakdown of all of our strategic objectives. I find this slide a bit busy, so we always go to the next one, which is an individual kind of slide for each of these objectives. So if maybe we go to the next one. Okay, so empower patients. This is kind of a fun one to talk through because it's really about how do we empower citizens and patients with digital tools to, kind of be connected into their health system. So we really want citizens and patients to be active participants and partners in care. And so one of the things we say that the first line is develop a consistent approach to their patients getting their health information. And we have a large unattached patient problem in our province. So that really means citizens that don't have access to a primary care provider. Sometimes they struggle to get the consistent access. They're going to different episodic care. What we can do here from a digital, and it's unique in digital, is we can attach us as citizens and as patients to our information. So as we traverse the different the different episodes of care, whether we go call an 811 nurse or we go to a walk-in clinic, our information should be with us. So at least we're attached to our information. If a referral happens, we should have access to that referral. So there is a consistency with us, and we've attached citizens to their information and the flow of that information. Another one we really want to focus on is the experience that comes with this kind of empowering patients. It's great if we have lots of different tools that everyone can use and connect to, but that really makes it just as hard as anything else. So what we need to do is look for consistent opportunity for experience. Like, where can we make the experience the same? And I think that's really one of the things we talk about, a possible digital front door. But what does that mean? Is that like, what is those things that we can do digitally to support patients to have a consistent experience as they traverse the different care, whether you're just looking for your information or you need information about a procedure, or you're unfortunately a cancer patient. What are the information you get? How do you get that consistently? So those are the kind of the key points of empower patients. If I can go to the next slide. Okay, so provider experience. So we use a little different word here. We said empower patients and we said improve provider experience. One of the interesting things we had when we went and did our outreach, and we met, it was fantastic. Doctors of BC were great partners in this strategy. We met with a lot of physicians. And we heard a lot about they understand the need. There is a definite need to get information, to digitally enable them. But sometimes we don't really think about how the impacts of those tools are on them and on their workflow. Seems quite obvious, but we didn't do enough of it. So there was really the importance of thinking of the burden that digital tools give. And so, that's why we have the words there: reduce administrative burdens and increase their capacity. We have an opportunity once again with digital tooling to not only help do the stuff that we need to kind of digitize and transform the health sector, but do it in a thoughtful way. And I bring out deliberate. I think that's the most important word on this page, to be honest, is creating a consistent experience through the deliberate integration of digital tools, systems, and data. So we have a tendency from a digital or IT perspective, kind of look a bit bottom up. Really, we have to look top down. What is the experience of those digital tools and what are the impacts on them? So over time, because it's obviously not something we can do right away, over time, how do we improve that experience with digital tools? Think of the impacts. Look where tooling supports providers, makes them more efficient for the system and improves their capability. And maybe just the last bullet is one that we heard a lot of feedback on was, you give us a tool, you don't train us. So a real thoughtfulness on how we do change management and how we train our providers as they move forward and we bring these new toolings in. If we can go next slide. Oops. Okay, so establish a connected health system. This is the third strategic objective. It really is, we used to call this interoperability. Interoperability is that's what we had it originally. It's not a best term. It is really technical, and really that's not the goal in some ways of what we're trying to do. And really we're looking at that seamless and secure sharing an exchange of provincial health data. But yes, the system to system sharing is important, and that's actually what happens. But it's really the sharing of information between providers and providers and providers and patients, and that kind of making sure that happens in a consistent way. And so once again, taking that experience, how does it affect them? So that's really the goal here. Is once again, even if we are looking at, say, the low-level plumbing of the system, we still have to think of the impacts of the workflows and how do we make it better. But we do have a complex system. It is hard to do it in British Columbia. From our, in our primary care EMRs, we have about 50 different EMRs in our primary care area, which is a lot. It's really purely from an interoperability point of view, that many endpoints are really complicated. So what we need to do is also change the way we in British Columbia have maybe approached interoperability over the past, which is sometimes British Columbia, we like to do our own thing. We like to be snowflakes. We would have a standard and we're like, you know what, we can make a better one. And then we wonder why no one adopts it. So it is a real opportunity here, and that's really the direction here is, I will say, we're taking a strong leadership role, even with Canada Health Infoway, to be part of that body of working with standards so that we get the adoption with EMRs. A standard that's not adopted is not really useful for us. So really, across the board, we'll be looking at interoperability in these things with an eye on how well can we actually implement them. The strategy is not meant to be static, we're meant to be active, and we want this stuff to connect together. So that's why we have a lot of goals towards standards. And then if there's a solution that works across the country or somewhere else, we don't want to reinvent the wheel. We will adopt it. We have seen and had learned from our friends in Ontario several times, and it's working there. Why would we create something different? Because our goal is to connect the people, not create just the pipes. And then there's one line at the bottom here. I think that's just, it's kind of, sometimes we talk about the interoperability, we forget about that last one, which is important in that we have a lot of, in our acute care settings, we also have a lot of different big clinical information systems set up. What we're looking here to do is also look for opportunities to work together to get the clinical practices common so that we can start looking at opportunities to simplify some of the workflows that happen between the acute care settings as well. So that's in there as well. And then if we can go to the last strategic objective, it's enable the business enterprise. So this is really looking for, I said it before, like the big systems that run the back ends of all of our health system, whether it's supply chain, human resources, capital. We're looking at how do we do this in a more provincial way so that we can optimize. We have across the province a huge HHR, so health human resources challenge. And sometimes we just make hiring too complicated because every single health authority agency has different processes and you have to be there. It's complicated. We want to simplify that. So one of the things we are doing is looking at opportunities to simplify. We are right now finalizing the procurement of a provincial HCRM, so a health resource system to help across the province, a single one across the province. Okay. And then I think that's I go to the last slide here, I think. Right, so where we are now. So kind of Heidi showed all the stuff that we're doing, so I'm not going to repeat all that. But I think one of the important pieces here for us is there's a roadmap that goes with this. And we're constantly going through and adding new initiatives. We actually are right now adding more. So when we started the strategy, we actually had a list. And then actually in the Word document, unfortunately, we have a list of initiatives that we're going to have to re-edit and pull out because they're already done or we've gone to new ones. And I think what we have here is this opportunity to kind of keep this dynamic. So it's there's so much work going on for us that what we want to do is bring that new roadmap out when we start actually pushing the document more publicly as well. One of the things we are doing as well is ensuring that we're measuring. So it's great to have those strategic objectives, those initiatives. How well are we doing against them? Are we actually succeeding in our goals? So a lot of what we're looking to do and what we have been doing, but even get better at, is how do we measure the success of it? And then as Heidi mentioned, we are going to be publishing this more broadly. I know our communication teams have been working great around getting this all published so people can read it and get more access to it. And I think that is the last slide. Okay. Thank you.
No problem. Thank you so much, Michael and Heidi, for that overview. I think I'm a registered nurse by background, and I think one of the most exciting parts or spaces right now with the digital health strategy is that we're finally at a point where patients and the system are truly wanting the exact same thing. I think we've always wanted, all of us have always wanted it to be better, but now we have a defined journey on how to make it better. And so really being able to leverage that collective energy and that collective motivation to achieve the digital health strategy objectives is really an exciting place to be. With that, I'm just going to grab my notes, but we're going to get ready for the next panelist.